Yeah. Ask me whatever you want to know, man. I'll give it everything.
One of the questions actually I have for you is you physio a lot of professional fighters, top 10 UFC fighters, and obviously, well, kind of in a gay way, you do get very close to them. What makes them different to an average person, a professional athlete? What's their body like in terms of how does it feel when you treat them? What do you think makes them different in the mindset and body as well?
2 words: high maintenance. That's what they are.
Yeah.
Most high maintenance human beings. Because you're talking about, especially if you're talking about a fighter, whether it's a boxer, cage fighter, they're doing something that the average person can't really comprehend. It's almost humanly impossible to the average person. And that's going in front of thousands of people, hoping to not die in there while still being athletic. It's crazy. It's like doing like extension 2 maths while trying to not die in a cage in front of thousands of people watching you.
Yeah.
You know, it's crazy. And then trying to not lose your breath while you're in there. It's one of the most emotionally demanding things. So I think that there's something that we don't speak about enough, and that's the psychology of a fighter. That's probably, based on my experience, the number one thing that would differentiate them from a normal person. That's what makes them so much more demanding as a client, because it's not so much about, can I heal quickly, can I recover fast, but it's the peace of mind they get knowing they're ticking all of the boxes. So, for example, a regular person comes in and goes, yeah, my shoulder is sore. This person might just be someone who goes to the gym 4 times a week and works an office job. If you just say, yeah, well, this is wrong with your shoulder and you need to see me for treatment once a week for the next 3 weeks, here's your rehab, off you go. Cool, stops at that. Generally, they come back. You don't really hear from them between that session and the next session. Fighters, man, 2 hours later, hey, man, is it okay if I jump in the sauna? And is it okay if I do an ice bath? And, what are your thoughts on getting the compression boots? What do you think about that? Also, what are your thoughts on cortisone? So you get hit with all these questions because they're just trying to do everything they possibly can to get an edge on their opponents, and they have to feel a peace of mind for them to be confident all the time.
It's interesting because a lot of people that haven't hung around fighters get confused actually when they meet professional fighters because they expect them to be very different.
Yes.
So they actually feel like, why are they so relaxed and they're actually not aggressive? The opposite actually what they expect.
Yeah.
And people say they're actually very like calm. And I say to them, actually, the person who does win a fight at a high level are people that are actually able to stay calm and control their emotions. And quite often they're not volatile people. You get a few of them people hear about in the UFC, but the top level guys are actually not volatile. They're the opposite. Yeah. If you look at most pro MMA fighters, this is interesting if we don't seem to understand with fighters or friends. I'm sure you had friends that fought wars. People think that they're not scared. No, they are scared. But being brave is not being scared. It's being scared and still doing it anyway. They're just as scared as everyone else, but they just do it anyway. And they control their emotions.
That's the most impressive thing about fighters, man. I actually draw a lot of inspiration from fighters in that they are scared, but they just do it anyway.
Yeah, they're just as scared.
And I think that what happens is that the fear doesn't go away with time. I think you just get used to handling it better. I see this, and it's really interesting when you see a fighter's demeanor change as they get a little bit closer towards a fight. They get more quiet. They're trying to actually just calm their nerves and meditate and achieve something as close as possible to a flow state prior to a fight, because and I think that's what separates, on the topic of world champions, a world champion versus a good fighter, and that's who can manage their emotions best. Because it's anxiety in there. And what does anxiety do naturally? You go into sympathetic overdrive. If we're talking about the nervous system, heart rate goes up, breathlessness, and you can literally freeze up in there. Or you get an adrenaline dump, and you see these fighters all the time after one round. Yeah, boom, like, what happened to his conditioning? I'm like, he's just shitting himself. He's just scared, man.
Yeah, that's a horrible feeling, the adrenaline dump. I've had a couple of amateur fights, and I experienced the adrenaline dump in my first fight. It was only about 2 minutes in, but those first 2 minutes feel like forever.
Yeah.
And then you experience an adrenaline dump. Arms feel like lead, legs feel like lead, and you think, shit, how am I going to defend myself? Like, that
absolutely, man. It's a scary thing, being tired.
Yeah, and then being tired, and that's actually my instructor, Roger Gracie. He's known as the best jiu-jitsu practitioner ever. And he had actually a very good MMA career. And he had a fight in the UFC against Tim Kennedy. Tim Kennedy was top 5 in the world middleweight, and Roger cut a lot of weight and actually cut too much weight. very late. Got in the ring, and he actually took Tim Kennedy down, took Tim Kennedy's back, and then what happened was bizarre. Like, couldn't finish him, and then Tim Kennedy reversed and got on top and was just smashing Roger. And ended up actually somehow survived, and it went to, he lost by points. But the point being, anyway, Roger was telling me that he literally said, James, you don't understand. When he got out of the choke, I knew that was it. And he said the most scary thing was I physically couldn't do anything. It wasn't mental strength. It wasn't. He said, no, Matt, it's not your mind. He said literally my body physically couldn't. I couldn't grip. I couldn't physically do anything. I just was petrified because he goes, what do you even do? I literally goes, it doesn't make any difference how strong my mind is. I physically couldn't do anything in that situation.
And that's why it annoys me when I see people do a little bit of pad work, a bit of bag work, and then go, I'm going to have a fight next year, put their hand up for a fight. You've had barely any sparring experience. You know what it's like when someone's in front of you and you're like, should I or should I? Should I or shouldn't I? Should I or shouldn't I? And then you get a little bit comfortable, you get in close range, and then boom,
cracks you or something.
Stars, and your legs start getting wobbly, and you're tired, and someone's getting closer to you, and you're like, oh, then the reality kicks in.
This is what I signed up for.
I signed up for.
I could actually die in here. And this is why I respect fighters so much, and this is why I look, being the Combat Physio Guy, working with high level fighters is what I signed up to. But I do it as a passion project because I really admire what they do in there and what they go through.
It's crazy. One of my very good friends, actually, Max Flynn, who's a professional fighter. Tore his at a grade 3 is the correct way. Rupture of the MCL in his knee ligaments. Had surgery. Actually, it was torn before his fight. Actually, had surgery. Had 2 pins put in, and I think he had an LCL tear as well. I think, if I remember.
ACL.
Partial. He had partial ACL tear as well.
Grade 1 ACL as well. Yeah.
Right. So he had that surgery. Now it's been 4 weeks, and you've been rehabbing him, and he's already running. He's already deadlifting. What's the magic? How have you done that so quickly?
How have you done that?
Oh, this is a great question because everyone's going to just assume steroids. That's what everyone says, like on the comment sections on Instagram. You missed the word roids. But you know what it is? It's that we treat Max like a serious athlete. The rehab has to be serious. You can't treat someone who's hyper athletic, young, hungry, like they're a 60-year-old geriatric patient in the hospital.
That's what they do. People do.
And that's why they do. And that's why you've got top people in the UFC, I'm not going to name them, but are taking a year to recover from the same or similar sorts of injuries, because you'd be surprised at the level of care that these top-level guys receive. You'd assume they'd have the best team in the world, but you'd be shocked at the type of people around them, because the classic physio is actually quite conservative. And you'll actually see, unpopular opinion, but much of my strength and conditioning programming ability comes from strength and conditioning coaches and PTs. The majority of my friends are colleagues, and colleagues are PTs. You're a coach, right? I'm not sure. Mike,
he is coach.
You're a coach too. There you go. Yeah. 2 of my best mates from back home, they're both coaches. One's a sprint coach, one's a bodybuilding coach. Then I've got friends of mine who are powerlifting coaches. So I think that I've got more friends as coaches than I do clinicians.
But most people, actually, physiotherapists are very conservative in their approach, being health professionals.
Yes, exactly. So S&C coaches aren't afraid to push their athletes a little bit faster because they know how far they can push their athletes based on their experience of what they've seen what their athletes can handle in the gym. Mm-hmm. So physios will get, not just physios, but clinicians in general, we learn a lot about pathophysiology, healing times, respecting the structural integrity of different structures like ligaments and tendons and muscles and bones. And we all know that they all have different blood supplies and healing capacities, but they don't have enough exposure in the gym in the context of programming, strength and conditioning programs for these sorts of athletes and then practicing it themselves. And that's the difference. So they're a little bit limited, or they're a bit intimidated by the healing times that they learn about in the context of injury and post-surgical rehabilitation, that they don't push their athletes a little bit faster. But at the end of the day, we're not treating pathologies, we're treating people. Mm-hmm. And if you look at someone like Max is, based on my assessment of me working with him for a while, and you guys have grappled with him at some point, he's quite dense and strong, which means generally people like that have a higher healing capacity and have overall more tissue resilience. They can just handle more. They heal faster. So guys like this, you can push them a little bit faster.
He's a combat sport athlete, right? He's not he's used to getting people pulling at him and putting him right. It's not the same thing as a normal person. No. Tissue quality, the tissue's more resilient, right?
Exactly. So I can't. If you left Max, with all due respect to the hospital system, if you left him for the hospital system, they'll have him maybe doing some crab walks and some clams, and maybe they'll get him doing some inner range quads in bed.
Extensions,
knee extensions. But my common rule of thumb is that why not aim for pain-free ranges early without disrupting or interfering with the healing process? So it's about finding the balance between pushing someone soon enough, but without hampering the healing process, making sure that in the case of his MCL, it's healing, it's stiffening, but we're pushing him a little bit faster than the regular athlete because we trust that he's got enough muscle tissue, he's got enough muscular resilience, he's got enough coordination for him to withstand the demands of training. And guys, with an MCL repair, they call it a tenodesis. So they basically staple down the tendon. Yeah, it's not going anywhere. You've got to really do a lot for it to come off. I learned that from one of my cousins back home, pro boxer and kickboxer back in the day. And same thing happened with his pec and his bicep. Surgeons
staple it in, don't they?
Yeah. It's not going anywhere.
We can work on this. Yeah.
Exactly. Yeah. That's the answer, man. It's a pretty boring answer, really. If you think about it.
It's fascinating. I think it's like you said before, people do rehab differently the same for someone as an athlete versus the National Health Service, NHS in the UK. You go in and you have literally an 80-year-old and they literally treat them exactly the same way as a professional fighter.
I had an anterior stabilization on my shoulder, dislocated my shoulder.
Ouch.
Yeah, horrible. Most pain I've ever been in.
Oh, yeah.
But the physios were kind of working on it. And my range of motion, I probably got about 60, 70% of my normal range of motion. And I was like, I need more than this. They were congratulating each other. I'm not trying to shit on them, but they're congratulating each other. And I said, I need more range of motion. Yep. And they were like, well, why? You're going to be able to do most things. And I said, I do jiu-jitsu. Like, if someone puts that in a Kimura or Americana.
Mentioning this,
so I've still lost I don't know how many degrees range of motion. So a lot of them don't realize. And so that kind of leads me on to the question of why you ended up becoming the Combat Physio Guy. Is that, was it because you wanted to work with high level, more resilient people, or what kind of led you down that path?
I'll explain why. So, I had a really tough time at university. A really tough time. I'm not sure if we've ever gone into this much detail about it, but essentially I got into physio with obviously the end goal of working with athletes. Didn't know which type of athletes I wanted to work with. I actually wasn't really into combat. I started off with combat sports as a kid. Then I played rugby league. That's where that's what actually drew me to physio to begin with. Tearing my hamstring, AC joint injury, concussion, ATFL sprain, bashed my kneecap once on someone. I ran into him, and these Islanders, man, got granite jaws.
They're different breed.
Different breed of joints.
Crazy, man. Built different. Anyways, and so I went into uni with the goal of becoming a sports physio, and a lot of my university degree revolved around hospital placements. Had nothing to do with what we call private practice musculoskeletal physiotherapy. It was very much similar to the NHS, public system based stuff. So there was I was in the hospital a lot with people who had heart surgery, laparotomy, so they've cut open their stomach and they need to get breathing properly again, and just trying to get them out of the ward into a new department or back home, just so they can clear up some more space. That was your goal as a physio in the hospital. So I didn't really get too much exposure. So I had a tough time with supervisors, because supervisors did not like that I was not going to stay in the public system when I finished. And they then, hate to admit this, but they project their insecurities on you, because they're on maybe 80K a year, Australian,
£40,000.
£40,000 a year.
Yeah.
And they're working maybe 8 to 9 hours, 10-hour days, bossed around by doctors in some cases, unfortunately. And then they see a student who is trying to escape the matrix, as per se, and do things outside. They're like, who are you? So they then project their insecurities on you and give you a tough time. So I had that. And for this reason, I was then training in combat sports, doing a bit of boxing, jiu-jitsu, etc. And I loved it. And it was an escape from the tough time I was having at uni. And I got really good, and I got to a point where a lot of the boys around me were like, man, you should fight, just have one fight. And I became obsessed with it. And I told myself, man, I just want to go to work one day and just treat fighters and talk to them about fighting. Nice. I swear to God, that's where it came from, man. And that then became like my escape. Like, I have to work with fighters. So what happened, I started making content in my second last year of uni. In my garage, like
long time ago, man.
Yeah, man. At the end of, I'll show you after this. In my garage, track pants, no shoes on, trying to talk about how to improve punching power. And I knew barely anything about biomechanics, but I thought, oh, this makes sense. And other guys are
interested in it.
There's something about these Aussies making content in their garage. I remember Lucas did the same.
Yeah. That's what give me a throwback. Yeah,
yeah,
deja vu. It was that. Yeah, it was.
We do everything in the garage.
Yeah.
Even our first house parties are in garages, like, drink ups, all that.
Are they sacred in Australia? Are they? The garage.
Yeah, the garage is like.
You know what it is? They have space. Because it's not that we don't have it because we don't have space. We don't have space in the UK. That's what it's to do with.
That's what's good about Australia. They've got a lot of space.
Yeah.
Anyways, I started making content. Became very passionate about making content for fighters.
Mm-hmm.
How to improve your single leg takedown. How to improve your kicking power. How to do this. How to do that. And then when I graduated, I was fortunate enough that all the content kind of led me to a point where fighters already started to know about me.
To reach out to you.
And I started working with fighters, and that's what got me into it. It's just that I loved how combat sports was an escape for me. It was a form of meditation. And I'm like, I have to work with these guys.
Mm-hmm.
It had nothing to do with money or anything like that. It's just like, I just love working with this population group.
I think working fights are, fascinating people. And I was thinking about this the other day, Mike, you would resonate with this massively. If you look at, I don't really care if it annoys people, it's just the truth. Industries like artistic industries such as fashion or literally art itself tend to have a lot of dicks. And the reason for that is, and people get annoyed, but it's the truth. And people who I know work in fashion or work in art say, oh no, you're talking nonsense. Then they come back to me and go, actually, everyone's a fucking prick.
Yeah.
The reason being is any kind of industry that the criteria for success is blurred, you tend to get dickheads.
Yeah.
So subjective, isn't it?
It's subjective. When something is just clear-cut black and white, people tend to be nicer.
Yep.
People that tend to pick things that are black and white, their views tend to be more ordered. They tend to be more logical and less emotional. Jordan Peterson talks about, and any psychologist, not just Jordan Peterson, proper psychologist, not Instagram psychologist, talk about how people that tend to be more artistic tend to have more mental health problems. They tend to have more mental health problems. And the reason why they do. And the reason why artists, etc., musicians, a lot of mental health problems, a lot of suicide, a lot of drinking, a lot of drugs. If you look at fighters, the reason why they tend to be very nice when you meet them is because the outcome is so visceral. You're either good or you're not. You get your head caved in, or you get submitted, right, in front of a lot of people. And same with people that work in industries that are very linear. Again, like a lawyer, an investment banker, a doctor. It's black and white. There's obviously grey areas, etc. But you're either good or you're not, or intelligent or not. And particularly in physiotherapy, you're a health professional. It's one way or the other, right? Yeah. And a lot of industries, again, like we look at it again. If you look at people in fashion or these industries, someone can literally just dislike you and get rid of you. If you're capable, if you're a fighter and you're good, look, it might be more difficult to promote yourself. We've seen fighters in the UFC that aren't that charismatic, they don't do as well. However, you're just going to eventually keep beating people and get there. Yeah. Whereas in fashion, if someone doesn't like you, they can hold your career back. They literally can control your career. And I got sidetracked, but I was saying the reason why people at fighters tend to be nice is because it tends to be so linear, the outcome. It's just basically either you're good or not.
Yeah.
Can't escape from that at all.
I agree with that. That's why on the topic of discipline and I think being masculine, I love this sort of stuff because most of the most insecure guys I know and the guys who go to, and look, with all due respect to anyone trying to improve their mental health, I get it, we've all got our battles, but when you see a lot of these, this is just my opinion, these gimmicky man crew retreats where they're just wrestling in the mud in the garden, they're yelling at each other.
Where'd you go? Where is this? You knew already.
Link in bio.
Link in bio. Bali, Dubai.
Don't worry. I already know. It's fine.
And I'm like, guys, just go to a boxing gym.
100%.
Or go do jiu-jitsu. If you want to go roll around, with other dudes and yell and grunt and mate, go learn something.
Can learn a skill and improve at it, right?
Yeah. Exactly. You know how empowering it feels knowing two things. A, you can defend yourself and your family. B, knowing how dangerous fighting is and why you will do whatever you can
to avoid it.
To
avoid it. Yeah.
It's like I actually just seen a podcast recently, or a snippet of it. Jared Gordon was on.
Yeah,
Jared was talking about how Jared.
Shout out Jared Gordon.
Shout out Jared Gordon, the man. I've got a lot of respect for Jared. And he's like, I think he was at a pub one time, and someone try to start a fight with him, and he's like, "Are you sure you want to do this?" And if a grown man with cauliflower ears,
yeah, he doesn't exactly look not that tough, does he? He's like,
"Are you sure you want to do this?"
Yeah, his impression.
You sure you want to do this? I'll be like, maybe I don't want to do this.
Yeah.
You know? So it's really powerful to go and for a man to go learn how to defend himself, defend his family, knowing that if you're in that situation, you can trust your default settings of your nervous system to go towards, all right, if someone goes for a choke, I have to move in this direction. And knowing that your instincts or your autopilot has now been rewired to successfully defend yourself and your family.
It's a little dog, big dog thing. If you look at people that don't know how to fight, it's two things. I mean, number one, that's why they're always aggressive to prove a point, right? If you know how you can fight, you're not aggressive. Compensating for it. And also as well, it's the thing that they don't realize how they're not tough at all. So we talk about this quite a bit between each other, but Rulan, you'll resonate a lot with this. So as a man, masculine men want to climb hierarchy, and then women pick the top of the hierarchy as their mate. It's just a fact. And it annoys people. The reason it annoys people is because it's the truth. We're animals. And the hierarchy for men is this simple. It's being able to fight, and it's earning money. Absolutely. And that's it. And people will try and go, no, it's just, no, it's not. And education as well is part of that because it shows competence.
Yes.
That's what it is. To earn money, whatever it is. But it shows you're competent, right? It ticks a box. Absolutely. Women know you're intelligent, right? So you can get through difficult situations and find a way around difficult situations. So as a man, us three are an example of that. Literally, you climb hierarchy, you want to improve your business, you want to improve your body, you want to learn how to fight. We're just talking about a minute ago. Or you become a man that denies the hierarchy, and instead of actually climbing the hierarchy among men by competing, what you do is you devalue a man that's above you. So what you would do, and this is actually how women fight. So women, instead of actually fighting physically, what they'll do is, say a woman is prettier than them, they will literally devalue that woman. So what they'll do is say that woman's sexually promiscuous. So that woman says attractive. What they'll do in front of men, they go, you know that woman's a whore. She's a slut. Every woman knows that's what they do. So, but what men are doing nowadays because of Instagram is they become more effeminate. So guys, what they'll do is they find someone, an example, the guy parks up with his Ferrari. Every guy knows that's cool, but you pretend it isn't. Might not be your top order of things. What they'll do is, I bet that guy's a small dick. Fortunately, they're actually right about me. But I think
they just got lucky.
They've got lucky. Or they're showering with me. But the thing was,
look, you can either be a grower or a shower.
I'm neither. But I'm neither of them. But what I meant was, so the guys will do that. The way they climb hierarchies like that. So we know as a man, it's very, very simple that if you suffering with mental health, I know people moan about Andrew Tate, and a lot of the stuff he does say is wrong, but one thing I do completely agree with is if you're suffering with mental health, go to gym or do a martial art. Physically move your body. I promise you this, your mental health problems are a lot less bad if you physically get strong and fit. Just go to a gym. There's loads of different reasons about this, right? You'll get physically strong. You feel good from endorphins. You see progression slowly over time. You're physically stronger, so you feel better about yourself. And fourth of all, you'll actually meet friends.
Social aspect.
Social aspect. I talk about this all the time, right? At my jiu-jitsu club, or all jiu-jitsu clubs have been around the world. The most important part about that is to me, it's not to sound like a nice person, is the friends I've made. I made the most incredible friends. And when I train here in Dubai, I've met Mike through jiu-jitsu, actually through business mentorship, but both black belts jiu-jitsu, most amazing people. I was sparred with all the Dagestanis down at Team Noguera. Cool, we have all these friends here, and I genuinely feel blessed when I go and train there. And I have amazing friendships, and I just feel sorry for guys that don't have a purpose like that or a friendship group like that. And the reason why a lot of people are miserable nowadays, Rulan.
Man, that is so powerful that you say that, man, because when I first got when I was a kid, I didn't really understand it as much, but as an adult, when I was probably 23, 24, and I wanted to go to sparring. I wanted to go rolling. I wanted to go pad work, and I got so fit so fast. And I remember from all of the amount of just the camaraderie that you develop with your boys, your brothers, and you really become secure. Like there's no there's no more real, like, okay, it's competition on the mats, but there's no competition outside of that. You've just done the most confronting thing you can do to each other. You've beat the crap out of each other. Like, it doesn't get worse than that.
Correct.
And you do it on a regular basis. So it's like you become more confrontational. You're like, well, I do this. I get punched in the face all the time, or I get choked out all the time. I get my, I do this on a regular basis. Like, what's the worst that could happen? Why should I be intimidated from you or you be intimidated by me? Like, we humble each other all the time.
Exactly. And you don't need to be aggressive outside the gym because you get your effective aggression inside the gym.
Yeah,
exactly. And that's why,
No, go on.
I was just saying, like, that's why I meet guys like you. I know are very capable, more than capable of defending themselves. And you're the nicest guys I know.
I'm not that nice of a person.
Well, you have no reason to be angry.
Relax. You don't feel angry.
Like, the guys at the gym, man, the ones that get me the most are the ones at the just your regular, like your commercial gyms.
Correct. Yeah.
And like,
staring everyone down, fluffing them to ground,
and being loud, and it's like, man, I can guarantee if you had just a minute with me.
Well, this is interesting. You said that today. I was at Warehouse Gym in Alcuz, and this guy, I was just trying to get into my locker, and typical me, I was pressing the keys, didn't work. Point being, anyway, this guy, I asked him, he was actually in the way. I said, "Sorry, mate, can I just get past you?"
Yeah.
I think, those people didn't even acknowledge you. "Oh, sorry, mate." He just didn't acknowledge me. He just moved across, and then I was doing it for like a minute, and I felt bad, and then he just looked at me like this, and just gave me this dirty look, and I just felt.
Oh, stop.
No, I'm being serious, and I just thought to myself, in my head, I went. It did go through my head, like, I literally could hold you down and choke you unconscious. And you wouldn't be able to do anything about it, literally. Yeah. And I said, I never would be aggressive towards you. I'm just genuinely being, it was so nice. I was like, "Oh, sorry, mate, can I just get past?" I said, "Oh, sorry, I'm taking a long time." Then he gave me this dirty look. Yeah, he did that. And I was just like, what are you doing?
Especially in a place like Dubai, where we know that probably the most valuable thing about this city is safety. It's like, man, what are you trying to do here? You ain't trying to do nothing.
Yeah.
That's why they do that, I think.
Exactly.
There's no consequences.
Yeah.
Australia or the UK, someone will just backhand you.
Well, that's the thing, man. In Australia, I can't leave my car. This is a whole different topic, but I can't leave my car unlocked. I can't walk into a car park at 10 o'clock at night and not look over my shoulder or on the way to the car. There are certain suburbs you stay away from. You guys are the exact same. Here, you could be 1 o'clock in the morning in Al Qusais or like Mirdif or wherever.
It makes no difference.
Car can be unlocked.
By the way, he's Arabic. He's half Syrian, half
half Lebanese. Yeah.
Yes, it is that half Lebanese. Yeah. If you couldn't tell from his accent, it was beautiful.
He pronounced things properly.
Like Al-Qoz.
Al-Qoz.
So I started weightlifting pretty young. I think it was maybe 15 or so. And I remember the doctor saying to me, "You can't lift weights because it stunts your growth."
Yeah.
And at the time, even myself back then, I thought, I was talking to my dad about this. My dad was pretty easygoing about it.
Yeah.
And I said to him, "It doesn't make any sense to play rugby. If you're playing in the front row in rugby, the amount of pressure you have from, say, pushing behind you, the other scrum on the other side, if you know what rugby is, you have people pushing against each other, it's on your spine."
Yeah.
And I was thinking the amount I can lift in the gym at that age, when I was like 14, 15, is not even comparable to the amount of pressure on my spine just from scrummaging or playing sport.
Yeah.
So what is this thing is it true about weight stunt your growth?
It's not true. Weights can't just stunt your growth. It's just what people said because they could not fathom the idea of a kid lifting weights. No, don't do it, it'll stunt your growth. There's no evidence to show that any specific weight training at a particular age will stunt your growth. Now, what it can do is you are more subject to overloading the tissues of a young person when they're still growing. So, for example, growth plates eventually, so the epiphyseal plates in joints when you're a kid, it takes a while for them to turn into bone, or for them not turn into bone, but more so for them to fully develop, and for us to see adult cartilage and bone and all of these sorts of things that we see through the natural aging process. So the cartilage of a child is not as robust and resilient of that as an adult, or as that of an adult, which means that we have to be mindful of how quickly we load up kids if they're doing tasks outside of the gym. So, for example, a kid that plays football, if he's training 4 days a week, 2 hours each time, then you go put him in the gym and go lift weights, he's more subject to something called, for example, Osgood-Schlatters syndrome or disease, right? Where basically those growth plates become overloaded and inflamed, and they get these growing pains is what they experience. So just it's the same principles that apply to us as adults. I like to look at strength training, or let's let's look at strength and conditioning. Strength and conditioning in the form of two levers. You've got your load lever and your recovery lever. In order for you to see positive adaptations, strength gains, more athletic development over time, you need enough load and enough recovery. But you can't have too high, your load can't be too high, it can't be too low. Because if the load's too high for your recovery, then you won't adapt. You'll plateau and eventually you'll see negative adaptations.
It's maximum recoverable volume, isn't it?
Exactly. Yeah. You'll see downward trends in your growth. So you'll actually start to get pain, you'll start to injure yourself, or you may not put on any muscle, you may not grow. But then if your load's too low, then there's not enough stimulus or stress for us to see an upward trend in adaptations. You're not going to see strength gains. You're not going to get stronger in the gym. That's why when you see these guys doing pendulum squats and they're not sweating, like, that's not a pendulum squat. So same thing that goes with kids. So that's why kids can absolutely train from the age of 12, no problem, even a little bit younger, depending on their frame and their genetics. But we just have to be mindful of how much load they're doing that whole week, what their recovery's like.
Awesome. That's really interesting. I was going to ask you another question actually about combat athletes.
Yeah.
Do you need to weight train as a combat athlete?
Absolutely. It should be non-negotiable for a combat athlete to do weight training because it's about maximizing tissue resilience. If you maximize tissue resilience, you will minimize risk of injury. These guys are in very physiologically stressful positions in unpredictable circumstances, and they're absorbing damage as well. So these guys need the bare minimum of just being structurally sound and resilient to trauma. If we maximize something called fatigue and load capacity, we maximize tissue resilience and therefore we reduce risk of injury. You just look at someone like Max. Max at one point, he'll openly admit this, I'm not going to say who he was doing this to, but he was injuring his teammates in the gym not because he was doing it on purpose, but because they didn't do any weight training. That was the difference. And I'm talking, I'm not going to name it, but top level guys were walking out like, look, Max hurt me. And I'm like, but you're this. How are you getting hurt? Well, the difference is that he's in the gym doing strength conditioning 4 times a week. You're not. So absolutely, man.
And would you kind of extrapolate that out to general population, like in terms of injury, reducing the risk of injury, right? Because a lot of people, especially we experience it like as coaches, they kind of avoid weight training.
Yeah, they go, the usual one, I have a bad back, but I know the answer, wanting to answer as a physio, I have a bad back, well, that's because you're weak.
Yeah.
That's the reason you have a bad back.
Yeah, very good point. So everyone should be strength training because it goes back to the concept of move it or lose it. You are designed to move. We are designed to lift heavy things, push heavy things. We're designed to do things, to do stressful things. Not when I say stressful, I don't mean, I'm not talking about things that cause maladaptive changes like smoking and eating crap, but I'm talking about things that are physically taxing. We are designed to do that, and if you don't, your body will not continue to adapt. So if we talk about anti-aging, for example, everyone has no problem forking out 3,000 dirham or 4,000 or 10,000 dirham to get some surgical procedures that don't even last, or cosmetic procedures that won't last. And look, each to their own. But I'm just saying that why is it a problem then to go sign up to a gym, reduce or limit aging from the inside out? The biggest anti-ager is lifting weights.
By far.
Isn't it?
It is the most powerful anti-aging tool in existence is lifting weights.
Absolutely.
More than anything, more than good diet, actually lifting weights is the most important one.
It's incredible. So if the general pop, if you have to have a large base, the longer you spend in that base, building up your skills, building up your endurance, building up your strength, then Gen Pop can then progress the same way a high level athlete can.
General physical preparedness to specific.
Yeah. Oh yeah.
You would enjoy that.
Oh, I can go on for ages about that. And back to combat sports or any athlete, the big rocks for being able to perform the skills of that sport sustainably developed in the gym. It's about building general physical qualities that will transfer into sport-specific qualities. You've got GPP versus SSP, sport-specific preparedness. And if you want to talk about programming, too many physios will look fancy on Instagram and they're not even really built that well. throwing around, med balls.
They haven't built the general physical preparedness,
the aqua bag stuff, mate. Go deadlift.
Deadlift,
so I know that if James grabs you right now, he's going to break your neck.
Exactly.
Where's your aqua bag now?
I can throw a ball at a wall though. That's enough, isn't it?
Someone like Max doing that's different because he already has general physical preparedness. He's already fit and strong. It's very different.
So the reason why we're able to progress him faster.
Amazing. Quickly before we go on to that, actually, there was about you have a really good question about the peptides, but it was actually about the actual reason, as you'll know this as a business owner, the real reason why people aren't willing to fork out money for a gym membership, maybe literally 500 dirhams a month, but they'll spend anything on cosmetic treatment, is because it's guaranteed.
Yes.
So if you say to someone in a sales call, if you literally have a guarantee that you'll get rid of that injury, people pay anything. If you can guarantee and click your fingers, you tell someone this, right? If you say to someone, say in dollars, right? If you said to someone, they'll spend anything on a car, it's guaranteed to make them feel good about themselves, right? If you said to someone, out of anything, you could pay, hey, I'm not joking about this, you said to someone, you can pay $50,000 on a nice car, Mercedes, whatever it is, like a decent car, or you get $50,000, if you earn a good amount of money, but then guaranteed, I can literally get you looking like granite, take your top off, and literally will turn their head and go, fuck, you look good. Anyone would pay that. But the real reason is they're scared they won't be able to do it.
Yeah.
That is the top of the hierarchy. People would they'd rather have an average car, but take the top off them and look good. But the problem is it's not guaranteed because no one can do it for you.
And that's a big thing that we battle with as clinicians, as allied health professionals, when someone has knee pain and then they see you maybe once a week for 3 weeks and there's no improvement and they're like, I'm going to go see someone else. And then they run into the same problem and then they end up back in your clinic doors with the same thing. And it's just, you can't beat hard work.
But people don't want to do that. Literally, they want instant results, right?
They don't.
Instant results are easier. Going for a glass of alcohol is instant results. It gets rid of the pain straight away, right?
Yeah.
It is. Exactly.
Absolutely.
Yeah. So
talking about reducing pain then, peptides have become very popular recently.
Yep.
With BBC 157, there's
TB500.
loads of them, TB500.
Yeah.
What are your thoughts on those? And I guess talk to us about how the average person would use them and then also the use with combat athletes.
Great question. Now, let's pretend that rules don't exist.
Yeah, remove that. It's not to the drug.
There's no more rules. There's no more this. And I'm not a pharmacologist or a medical practitioner to know how to prescribe these sorts of things. But based on my observation and based on my clinical experience from what I've seen, if let's categorize peptides under the umbrella of regenerative medicine. Regenerative medicine meaning how can we speed healing and limit aging? That's regenerative medicine in a nutshell. You've got a combat athlete that needs to fight in 2 months, but you're looking at an injury that would typically take 5 months. So this is where things like dry needling and massage and rehab is just not going to cut it. This is where we then have different sources of regenerative interventions. One of the most popular ones now is PRP, platelet-rich plasma. How PRP works, they extract blood, they place blood into a device called a centrifuge, it spins the blood, suspends plasma from red blood cells. Plasma now has a higher concentration of platelets. Platelets naturally contain healing ingredients like collagen, elastin, and fibrinogen, and all these cool stuff. These fancy healing ingredients that your body normally uses to heal itself. We have a higher concentration of these platelets with these healing properties, and we re-inject it into an area that's pathological. Hopefully we then bypass biology in that we can get more of these healing ingredients in an area where there's a failed healing response and we can speed up healing. Why do I bring this up first before I talk about peptides? Is because that's I suppose the treatment I grew up on in terms of clinically, referring out to a sports doctor to give the PRP injection for those who aren't healing fast enough. But I realized something. Some structures just don't respond to PRP the same way as other structures would. So for example, PRP might work really well on a supraspinatus tendon or in a disc or an SI ligament. Almost 9 times out of 10 clears it up. But then you go inject PRP in a knee, bang, blows it up. Then you go inject PRP in elbows, bang, blows it up. Then I realized something. My hypothesis is that, and by the way, not all sports doctors can answer this. There's still a great grey area, which allows me to kind of make my own hypothesis without being slammed. My hypothesis is that if you puncture a tendon with a needle with a large enough density, you might just end up just traumatizing the tendon so bad you end up just sending them backwards. You blow it up instead. If you look at patella tendon, you look at elbow tendons, like common extensor origin, if we're getting fancy with terms. If you puncture with a needle, it might just, even though the PRP is there to do its job, you end up exceeding their therapeutic threshold. You do more damage than good.
Right.
So then in that case, I've then seen people resort to peptides. Then they get better. I'm like, okay, maybe we're onto something here. Maybe PRP isn't always the best option for people with tendon-related problems. And if we look at things like peptides or certain peptides versus the molecular structure of platelets, they're a lot smaller, which means they're more permeable compared to a platelet, which means it's easy for them to permeate the cells and tissues of these structures and do their job. Versus PRP is a little, if we're talking about molecule size, they're larger and therefore comparably less permeable. So in that circumstance, I think that peptides can work really well with certain tendinopathies, elbows, proximal hamstring tendons, patella tendons, and in some cases, they don't work at all. So overall, what do I think about peptides in particular? I think that for certain pathologies and for athletes that need to get back fast, I think they can work really well. And I'm hoping that they do start to legalize it more around the world, because I don't see it as necessarily performance enhancing, in my opinion. How is then physiotherapy not performance enhancing then if I'm reducing your pain?
Exactly.
Very, very good point.
Or recovery enhancing.
Exactly.
Yeah.
If I'm taking protein powder to replace my steak, then I can recover a little bit faster than someone who chooses not to eat properly.
Particularly BBC 157, it's for an injury, right? It's not.
Exactly.
You're not using it to get strong. It's literally for an injury.
For an injury,
Yeah.
and then if I can heal from an injury a little bit faster, because we have the treatment to do so, we've got the technology to do it, and the knowledge of biochemistry, pathophysiology to do it. Then what's the big deal? People don't have time to sit around for 3-4 months. There's big money on the line here. They're feeding their families. No one has time.
Exactly. And also football players, so getting back to playing again, you don't lose money as a football team, right?
Look at Ozempic, for example. People left, right, and centre taking it's a peptide.
Yeah, of course, and that's fine, right? What question as well for you is with you being a physiotherapist?
Yeah.
What are your thoughts about chiropractors and osteopaths in terms of how would you use them? What your thoughts on them? How would you, as allied health professionals, how would you use them in a clinical setting?
So chiropractors are traditionally spinal health professionals. They treat the spine. But what's happened, and same thing with osteos. But osteos is more centered around the body being in homeostasis and balance, and that would come in the form of not only just manual manipulation of the spine and joints, but also with supplementation and diet and things like that. But what's happened is that over the years, all of the professions have somehow, some way have become hybridized. Now it's confusing. It's especially confusing for the consumer. The consumer doesn't know who to see anymore.
No.
Do I see a chiropractor? Do I see an osteo, a myotherapist, or a physio? Some professionals just say it doesn't matter as long as they understand what to do for your rehab. I'm like, well, not necessarily, because why expect a chiropractor who's an absolute weapon with spines in manual manipulation to take care of your rehab when you've got an excellent S&C coach or a physio to do that? So for me personally, I think that an osteo these days you can't tell them apart from a physio really, or a myotherapist, which is a massage therapist who can do a little bit more around joint mobilization and manipulation. So, but for me personally, if you can have a good chiropractor that you can refer out to for spinal related problems that you cannot resolve through the basic manual therapy modalities of massage and needling or through rehab alone, then you refer out to a chiropractor. That's, I think, where they can work really well with one another. Shout out to my man, Dr. Hassan, chiropractor. He's someone who, what I like about his approach is that he stays in his lanus per se with the spine and how the neurology then influences the spine and vice versa, and how can we down-regulate the nervous system and the pain signals it's causing particular restrictions, which then allows these clients to then come back and see me to be in a state where they can receive the treatments I can give them, which then gets them back in the gym. Whereas an osteo, traditionally we're like chiros, but you don't see osteos practicing like chiros anymore at all. So it really just comes down to if the osteo can be as diagnostically sound as a physio, they've got similar manual therapy skills and rehab ability, they're just as good as a physio.
Yeah, awesome. Yeah. So as a health professional, as a physiotherapist, a lot of people don't do that well in business in terms of they can be the best physiotherapist. However, they don't do that well in business. What do you think? If you give 2 tips to people, what would they be?
Find a mentor immediately. Yep. As soon as you graduate or while you're at uni, find a mentor. Find someone you want to be like. So I want to be like that guy, and just stay around them. Stick around. Offer them free work. If you can't afford to pay them, offer them free work. So simple. There's no excuse. For me, I've got an online intern right now. I don't pay her, but I give her mentoring. I teach her. I teach her everything. And she's incredible for me. So number 1, find a mentor. Number 2, just be open-minded. You know, a lot of practitioners think that they have to choose a side. Why do you have to choose a side? Just do what makes the most sense for the person. If that's where you want to be in 5 years, you need to reverse engineer the steps required to get to that point through actionable items that you do on, you know, whatever that might look like, a weekly or monthly basis. So if you want to be the practitioner that can diagnose, that can treat, that can build out strength and conditioning programs, that knows is so diagnostically sound that you can compare them to a radiologist, or that they know when to refer out to a sports doctor, go and learn from the best S&C coach. Go and learn from the best massage therapist.
Correct, yeah.
Go and learn from the best radiologist. That's my biggest advice. 2 biggest tips.
Amazing. Just find a mentor, and then basically find a mentor that's done it before, and then just be around them. Learn off them. Pay the money sometimes. All the people I know become super successful. What example be Stan Efferding. He's a very, very famous bodybuilder. He's a multimillionaire. Wanted an IFU Pro. Went to Flex Wheeler. Gave him money. Learned off him. Became an IFU Pro.
Yeah.
Then he wanted to be the best powerlifter. Went to Mark Bell. Super training. Paid loads of cash. Then became the world record holder. And that's how he's become good at everything.
Absolutely. Get good, and then skills pay the bills.
Exactly.
100%.
Awesome. Thank you
This
so
was
much.
awesome, man.
Yeah.
Thank you,
so
guys.
much.
Thank you.
That was fun. Thank you so much. I really appreciate it.
Where can people find you?
You can find me on Instagram. Type in the Combat Physio Guy. I'm also on TikTok, the Combat Physio Guy. I'm an Australian-based clinician living in Dubai, and I solve worldwide pain problems. Let's Oj.
Oh, God. We'll cut that bit out. Thank you so much.
We'll add subtitles.